I love this incredibly niche question, and I don't think I've ever been asked this on social media. So we see patients on a semi-regular basis who have a history of vascular disease. So they have decreased blood flow to their lower extremity or their legs or feet, and they end up with wounds for various reasons. And once those wounds heal over, which can be quite a challenge to just heal those wounds in general, they end up with decreased cushioning. So sometimes the skin is directly on the bone, and depending on where the wound was on the foot or ankle, they can develop areas that actually hurt when they walk, but also areas that rub on shoes and even clothing and can cause wounds. So first and foremost, anytime you're dealing with a patient who has vascular disease and resultant wounds, it's really important to do your best to correct what you can. So if there is perfusion issues to the lower extremity, it's always best, of course, to get those things solved before I, as a plastic surgeon, go mucking around down there. So once you've determined that the perfusion in the area is sufficient to heal, my favorite option for patients that have decreased padding, especially on the heel, is fat grafting. So fat grafting is a technique that we use all over the body for all different areas, and it can be very powerful in this particular instance. But it is, of course, very important, like I said, to make sure that the blood supply is sufficient to the area that had the wound so that the fat grafting will take and we won't have complications. Because as you noted in your comment, we don't want to do things that are going to cause more wounds and more problems for you. So in my experience, fat grafting can work very well in this area, but you do need to be careful, and it often takes more than one round. So often if you have an area where you have skin directly on bone, in order to get enough padding that the area is more back to normal, we typically have to do several rounds of fat grafting to thicken that area up. Now, these areas in patients with vascular disease don't heal well at a baseline. And when you've already had trauma and healing in the area, they heal even worse. So it's very common that I use adjunctive therapies like hyperbaric oxygen therapy to aid in the take of your fat grafting and to aid in your healing. And I've had really good success with doing this with pretty low complication rates. So patients are alleviated of their pain and they feel more mobile and functional. So it's a great option for patients with a history of wounds from vascular disease that are now healed.